Welcome back. Some of the shortest days of the year are on their way in the next few weeks, and if lack of sunlight has left you with a case of the blahs, you are not alone. Dr. Timothy Quinn, who practices family medicine in Ridgeland, joins us now live in the studio to talk about seasonal affective disorder. Dr. Quinn, first of all, what is SAD?
Well, I mean, it is a real medical diagnosis. And this past weekend, my wife and I, we had such a great time in big New York City.
Oh, yeah.
Hanging out with my daughter. But she was telling me about a service at their school that they offer called light therapy. And she was like, Dad, what is light therapy? But I explained to her it's a treatment for this condition, seasonal affective disorder. Some call it SAD, and it is a form of depression. It's a real diagnosis. And it's experienced by a lot of people during this time of year when the days are a lot shorter, a lot less sunlight. And what happens is this triggers a chemical imbalance in our neurotransmitters to include our serotonin and our melatonin. But it throws off our circadian rhythm or our internal clock.
So you could be losing sleep and be irritable, be sad, really?
Well, I mean, basically, individuals that have this condition is more common in young people than older and much more common in females than males, but they'll have symptoms that are very characteristic. They'll be sad a lot, you know, just decreased mood, just blue, even crying spells, decreased energy, just can't get enough rest, sleep all night, want to sleep during the day, decreased interest. They don't want to go anywhere. I mean, they used to hang out with their friends, but now they just want to stay in their dorm room and stay secluded. Decreased concentration, can't focus on their schoolwork or their job. But what we have to also look for is increased appetite. A lot of them, they crave carbohydrates and sugars, and a lot of them gain weight. But most important, we have to look for suicidal ideation, which could be deadly. So that's why it's so important that this topic be taken seriously. And if someone exhibits these symptoms, it's very highly recommended that they see a medical professional for a proper diagnosis and treatment.
Now, you talked about light therapy. We're not talking about getting in the tanning bed. This is a specific type of light that could help with this, right?
Right. The light therapy is very effective. The research has shown that most individuals, they'll receive this therapy. It has to have what's called a lux rating, about 10,000 lux. I went on Amazon last night and found one for just 50 bucks. It's very inexpensive, and it's recommended to be exposed to this light for about 30 minutes to 60 minutes in the morning hours, and a lot of people get a lot of success within 1 to 3 weeks of treatment.
And then seasonal affective disorder, what about when springtime rolls around, the days get longer again? Will it clear up on its own in many cases?
Well, most people do get better during this time, and that's part of the diagnostic criteria in order to be diagnosed with this condition. But some people even need medication. Wellbutrin has been approved by the FDA, and what it does is it raises the norepinephrine and the dopamine, and it combats those symptoms, and a lot of people get a lot of good results.
All right, Dr. Quinn, good information as always. Thank you for joining us. Quinn Family Medicine in Ridgeland, Mississippi.